Get ready for the Teen Summit podcast, presenting the teen co-host, Aisha.
Huh? Are you crazy?
Jordan.
Like, I can smell you across the room with that.
Naya.
He's a what now? What is he?
And presenting your host, Rachel Bernadette.
Right, we're in there. All right. Hey everyone, welcome back to the Teen Summit podcast. Last week on the episode, we discovered school resources, office, purpose in school buildings, many students fights and argues while in person while trying to fit into a new school environment. Today, we are super excited to be back on our 18th episode, where we will be exploring Health Literacy Month in a variety of different ways. On today's episode, we will be covering a variety of topics from abortion laws and Health Literacy Month. So let's start it off with the intro clip.
The Laffy presents Teen Summit Podcast with your host, Miss Ray. Youth with passion. Youth who speak their mind. Listen to the voices of our youth. Youth who care.
To start it off, we have a very special guest today who will be helping talking about Health Literacy Month. Her name is Dr. Reni, and she is from Laurel, Maryland. She majored in biology at Howard University, and she wanted to pursue a career in medicine, so she stayed at Howard and graduated from medical school early in 2021. She's currently a resident physician at VCU in Richmond and as a obstetrician and gynecologist.
Hey, Dr. Reni.
Hi, everyone. I'm so excited to be here with you today.
Yes, so glad to have you. So I know Dr. Reni through my friend and my sister, actually, my friend's sister friend. My sister went to Howard, and I got to know Reni and see all the amazing things that she was doing. And I just wanted to give her an opportunity to just share her perspective on literacy, health literacy, why it's important for teens, why and how can teens and young people just understand themselves and know thyself, so that they can be whole and healed and being able to be free to just learn and grow. So October is Health Literacy Month, and October Health Literacy Month is a time to recognize the importance of making health information easy to understand and understanding the healthcare system, understanding different words that people use when you go to doctor's offices. And so knowing why it's important to be healthy, be able to talk to your doctor, get the information that you need. And then for teens, just being able to feel confident in like understanding how to be one with yourself. And so we're going to dig into a variety of different topics. But first, I wanted to backtrack a little bit and share some statistics on health literacy in general, and how much of the population is health literate and knows different things about their health. And so about 12% of US Americans have some grounded knowledge of health literacy, whether that being able to read a prescription, talk to their doctor, even know questions about their own body. And I thought that was really interesting because it's such a low number. But if you just look out at the world, there's so much sickness, so much disease. And part of that, in my opinion, comes from this lack of knowledge or not even being able to apply that knowledge. And so as teens, like, how do you become more health literate? Like, instead of going to the nurse's office when you're sick, like, what are some ways that you can become more health literate? And one thing that I think is a good way to talk about this is through social media and, the ways that you all interact online. And so in your experience, what are ways that you've learned about health outside of like going to the nurse in your time in school and even in college?
I honestly just did my own research about it because I feel like self-awareness is where a lot of things start. And especially with making sure that you're healthy or making sure that you're not, catching all types of bacteria and things like that are very important. So if you can't get those resources from the nurse, I feel like just doing your own research and being sure that you're keeping yourself informed on how these bacteria where they can come from and how to avoid getting them is very important, because you can even get them from your phone, because a lot of people may, touch your phone, or you may leave your phone somewhere, and even in the air, bacteria can come from a lot of different places. So I feel like just staying aware of those certain things is very helpful.
Well, I think this also includes sexual health too, because as teens, they're starting to get curious, and I'm a peer sexual health educator, so I learned a lot about sexual health and all that kind of stuff. And so just having those kind of programs to help with that really helps. And just being able to be a peer educator and being able to ask, being able to also educate others.
So what empowered you to want to be a peer? Is it peer sex health educator or para sex health educator?
The first one.
Okay, no, because there are things called para teachers, which are teachers that are co-teachers with the main teacher. They're para, they support the teacher. So that is actually a thing. I don't know if there are para sex health educators, but para is the word that goes in front of things, but I digress. So yeah, what empowered you to feel as a young person, even exploring and feeling empowered to become that?
Because I think that's one of the things that a lot of people don't talk about. So people are always so uncomfortable talking about sex and health. And so because people are always so uncomfortable talking about it, nobody really gets into the details on how to make sure you're being safe and not to catch any diseases or infections or anything. So I think that's one of the things that really was okay, I'm gonna try this, because I wanted to learn more, so, and be able to help others.
We're gonna come back to that, because I think that leads into some of the other topics that we wanted to share. But any other comments or feedback on how to just be empowered about your own body, just put it straight, and your own health, and taking charge of that?
I feel like, especially in times like this, it's really important to just take all the necessary precautions to make sure that you're keeping your hands clean, or wearing your mask, or making sure you sanitize, and just, I don't know, stay clean. At my school, we are sure at my school, they make us wash our hands every 3 hours, or sanitize to make sure we're not I don't know, like just keeping bacteria or dirt on our bodies, especially since it's like COVID. Now yeah, I see your face. But I feel like just being precautious and making sure that you're staying clean is just really important. That's like one of the best ways to feel empowered in your body.
I was making that face because I was thinking of all the lotion that would be needed for all those times washing my hands. I already, because like I sanitize my hands like very often. Like I literally like probably refill my hand sanitizer like once like every week, because like I use it like crazy. Like even for like the littlest things, like I could like literally go to the bathroom, wash my hands, and come back and still put hand sanitizer on. Like yeah, I use it a lot.
Important to like be healthy, because you're not only like helping yourself, but you're helping others. Like I have a baby cousin who I used to babysit all the time, and it's very easy for infants to get sick. So it's like you have to be cautious and aware of like your health, but also to help others be safe as well.
Yeah. Naya, I just wanted to go back to you and ask, like, what type of things, you don't have to go into detail or anything, but like, what type of things do you guys really talk about when you're, educating other students on peer sex things? I hope I got that right.
No, you're good. You're good. You're good. Peer sexual health educator. We kind of just like, okay, so I more so like learned it myself. Like we learned like this summer, they had a little workshop, like that was a week that we just got into like um, I would say the, hmm, the basics. So like just like understanding like people and not judging them, and like just like learning about condoms and learning about like just sexual health like in general. And then we had to take a little test so that we can know if we could like so you can get our certificate or whatever. And then so during the summer now we're like summer during the school year now we go to like so I go to work like every week, and then we distribute condoms like at school. And so and then I haven't started really at my school, but I know that I am gonna probably do like a demonstration thing and like just saying like, oh well, this is what I am and how to like make sure they take care of themselves. But we just kind of learn about like the different kinds of like um STIs, and we learn about like condoms, the way they use them, especially like the certain different kinds, because I did not know there were so many. And some of the other like nitty gritty thingies.
Okay, thank you. Sorry, I'm asking because I feel like it definitely connects to one of my favorite debates of all time, which is abortions. And I connected to that because what you do is basically allowing other people to understand more about their bodies. I'm sorry, I don't know what's going on over there. We're not gonna even talk about that. But yeah, I
He
feel like
wanted to like yell and scream about this topic. He's like,
yes.
I'm so passionate about knowing about their health. So I've got to let my voice be heard,
Yeah, he's still passionate about it. We're just gonna he's just gonna cheer us on, we're just gonna allow that. But yeah, I feel like it definitely allows people to understand more about their bodies. And I thought it would be really good to ask you to like talk about it more, because the Texas Heartbeat Act is actually a law that allows private citizens to sue abortion providers and anyone else who helps a woman obtain an abortion, including those who like even give a woman a ride to a clinic or provide financial assistance to obtain an abortion, like giving her money or something like that. And private citizens who bring these suits don't need to show any connection to those who they are suing. I brought this act up because it also ties back to the Texas law of women not being able to have an abortion 6 weeks into their pregnancy, which is also a time where they first find out about their pregnancy. And this law makes no exceptions for cases involving rape or incest. And recently, I believe yesterday or the day before, the Justice Department asked to appeal the courts to suspend the law. So I just really wanted to ask, what are your stances on this and why?
Okay, so yeah, I don't agree with abortion. Like them having that law, like you can't have abortions because you never really know what the circumstances of that abortion could be about. But we learned so we as like teen self peer peer educators. I still get it messed up too. So like we learned about like contraception, like things that we can do to like, you know, even before you even have a birth, like no, like to prevent it, like things that like birth control, like different types of birth control. And then we also talked about things like the alternatives if you actually get pregnant and you don't want to keep the child, or like say if you wanted to have an abortion, that's one of your options. Another option is like safe haven, adoption, or just keeping it. So we learned about all of those things. Also, not to judge people, even if they like do or don't, because I mean, to be honest, I feel like it's people's choice if they want to have an abortion or not. Especially if like I feel like especially if the mother is like it's a like die or survive situation. Like if the mother like can't survive and um the baby hasn't even really fully developed, or like it's just a fetus at the time. I mean, if she has to get an abortion, I feel like that should be a thing that she should be able to get. Or if she feels like she doesn't want to be reminded of that child all the time because she got raped or something, she should be able to say, oh, I want to have an abortion. That's just my input.
Yeah, absolutely. I agree with everything that all of you guys have said. I just wanted to first comment, and like I love how aware all of you are. I feel like right now is like a really trivial age that a lot of you guys are at, and it's really hard for a lot of people to be aware of their bodies and be aware of the things that are available to them. Something I did want to mention in case not a lot of people know is there is something called medical emancipation. And so as a young adult, you're allowed to get advice, get help about any sexual health, anything related to drugs, alcohol, anything like that without your parents' knowledge, because that's considered medical emancipation. So if you did want to go to a clinic and say you're just not comfortable talking about it with your parents, you're able to do that under the medical emancipation law. And then in regards to like the Abortion Act, I agree with all of you. I feel like it's just not, I feel like it's not ethical for one. I feel like it's not fair to a lot of women. I think it really brings a point where it's really important to have advocates and allies, because in the law, there's this like a little clause that says, unless it's medically necessary. And so there are a lot of doctors that are like kind of walking around the line of what's considered medically necessary just so a woman can get the care that she needs. So I think it's really important that we continue to have advocates and allies for women's health and women's sexual justice and things like that, because other than that, there's a chance that a lot of women can be silenced and aren't going to get the care that they need or deserve because of laws like this.
And because you have been studying this for how many years have you studied? Let's like start there to even be an OBGYN, and like what fueled you to this pathway and kind of being able to go deep in some of these topics that we're talking about?
Yeah, so it's 4 years of college, and then 4 years of medical school, and then OBGYN residency training is 4 years. So it's a bit of some years, but I realized that I did want to do OBGYN, one, because of I don't know if you guys have ever heard about like the Black maternal mortality rate and how Black women are more at an increased rate and of dying from pregnancy related deaths than their counterparts. And then when I looked into that as well, I realized that, women of color and minority women are more likely to die about anything, like surgical related infections. Everything is like, it's super high, in women of color. And so that's what really fueled me into going into OBGYN, because I wanted to be an advocate for, women that look like me and women of color and making sure that they're getting the care that they deserved. And so I've seen this a lot where it's women coming down from like different states needing an abortion because, their state doesn't provide it for them. And so I think it's just really important to make sure that you're aware of, allies and aware of places where you can go. I think Planned Parenthood is an amazing, organization, and they do absolutely wonderful things and make sure that everyone gets what it is that they need.
I want to ask you a question. So, what if, when is like the average time when like a woman knows that they're pregnant?
I think that varies for a lot of women. I think it depends on if you have regular periods or not. Because if you don't have regular periods, you honestly might not know for months because you're just like, oh, well, I never get periods every 3 months anyway. So this missed period doesn't really mean anything to me. If you're somebody that gets periods very regular, you might know sooner after that first one, because you might be like, it's kind of been a week. And so you might take a test if you feel like you're at risk of pregnancy. But I think a majority of women know, honestly, around like 8 weeks, like 6 to 8 weeks, especially if they're not actively trying to have a baby. Because of course, if you're trying, you're taking tests more consistently and you're doing all the other measures. But if you're not, it's typically around like 6 to 8 weeks.
Thank you.
So, Dr. Reni, in your experience of just as you've been learning in medical school and in residency, I don't know if you've worked with the younger populations or just engaged with them, but like, what are some of the fears that you hear people talking about around just empowering themselves with knowledge and health, and like the barriers that can come up, and then solutions that you as medical providers are encourage them to like take advantage of?
Yeah, I think at this age, a lot of the questions that young people have, I think, are absolutely great questions. They're really curious about what it is that's happening to their body, and they're not afraid to ask questions, as opposed to older populations where, there's a little bit of timidity and like just trying to like hide behind a wall. I think a lot of the fear in that population just comes with, oh, what will my parents think, or what will my friends think, or how does this affect me socially rather than personally? And then that's why I really wanted to bring up the whole medical emancipation, because whatever it is, whatever healthcare you get, that is your right. That's your privacy between you and your physician. Just like this, the same way between you and like a psychiatrist, a psychologist. So it's nothing that ever has to be like shared or, divulged out into the world or anything. So you should just be confident and feel like I'm going to get the best care for me with my provider.
I'll ask devil's advocate question. What role does the maturity of a young person play in that? Because on earlier episodes, we've talked about adultism and how adults kind of just belittle children or teens in the sense of, well, you're not old enough to really make decisions about XYZ. You're not old enough to know X. And so maybe this is a question for everyone, maybe not just you, Reni, but how do you know, like, when you are mature enough to be able to make decisions independently of your parents as it relates to your body? And this is just so we can kind of see all different perspectives, if anyone has a thought on that.
Yeah, I think that's such a great question, because it's like, as you get older, I feel like people still have that question. I've seen people in their 20s and 30s that still call their parents about medical decisions. And so I really don't think, I think it sorely is like that self-awareness that you guys talked about. If you are aware of the changes that your body is making, you're aware of the things that you're doing, I think you're perfectly capable of making decisions for your body. One, because it's your body, and you have to deal with and live with the consequences of whatever decision you make. So I feel like you should always just do what you feel is right for you. And whether if you think talking to your parents is right for you versus not talking to your parents, I think that's all within your right and all within your decision. And so I think everyone should just do what it is that they feel is best for them.
I'll add in there being able to, we always talk about support systems on the podcast and having those trusted people, whether it is a parent or not. It can be an older friend or a counselor at school, and being able to tap into those different resources. Because what I've learned, like you, Reni, as I've gotten older, it's like, okay, what's my voice? And when I make a decision, and what is the voice of other people that's maybe making the decision for me? But having that different perspective and letting others know what's happening has always given me a safe haven. And so for young people, I think it's very important to never make decisions in isolation, because there are so many great systems that are available. Just even Naye, what you shared about like the peer resources. And on the last episode, we talked about why is fighting so just prevalent in schools and what are ways to diffuse that. We talked a lot about peer mediation versus going somewhere external. So finding that balance is just really key. And I think having conversations like this and more teens being open to just say, you know what, like I am curious about XYZ. Because what I've seen with teens is that when you, and myself too, when we're fearful about something, we tend to just not talk about it and keep it in our head as like, well, am I the only person who thinks this? Or people gonna think I'm crazy? Just like what Dr. Reni was saying. So I just would add that in there as well.
Yeah, I definitely agree. I think having mentors at every single stage is super important.
Mm-hmm. So I'd like to just open it up for just a short, like, ask me anything segment in terms of health literacy and being able to, or questions that you maybe have heard teens talk about in your schools and even young adults, you, Jordan, at the college level. That you're maybe curious about. We've always wanted the podcast to be a safe space for teens to be able to use their voice for good and change. So anything that has been on your mind, and Dr. Reni, you're more than welcome to be like, I defer not to answer that, but I wanted to give an opportunity maybe for a couple of questions to pop in here.
Okay, so I have a question that I'm dying to ask. At my school, a lot of the students tend to focus on body image a lot. So I really wanted to ask, what does it mean when you experience like excessive weight loss or excessive weight gain?
That's a really good question. And I feel like, oh my goodness, I could talk about body image for so long, especially now with like social media. I feel like it's gotten worse and worse. And I think when you hit puberty, your body's just going to change. And something that I realized is that there's like a second puberty. So when you're in your 20s, your mid 20s, your body's going to change again. And that's perfectly normal. I feel like with excessive weight gain and excessive weight loss, I think it really depends on like the time frame and if you're experiencing any symptoms with it. I will say that there are some times where someone gains weight or lose weight really quickly. That's when we tend to get worried. If you feel like your weight is changing and you're not doing anything about it, like you haven't changed your diet and you haven't been like exercising less or more, I think that's something to be like, you know, what's going on? And that's something that, you know, you can talk to somebody about whether or not you need to go see a physician or see a provider. But I think as our bodies change and the hormones fluctuate and we figure out what it is that we like to do and what we like to eat and things, I think your body's going to change, and that's fine with it. And I think it's just really important to just maintain healthy habits now and then continue as you get older.
What are some ways that teens can be able to, like, maybe conversation starters that you've been able to use with patients to have like hard conversations, or not say hard, maybe awkward conversations or like uncomfortable conversations with their friends or their parents about their health, whether it's their physical health, whether it's their sexual health, their mental health. How do you have any advice and ways to talk about things that might be a little bit uncomfortable?
That's a good question too. I think a lot of the times I think it's really best to set the tone. I think setting the tone before you have a serious conversation is important. Because a lot of times, I don't know, I guess we're in a stage where people don't take things as seriously sometimes. And so I think, if you want to have a conversation with someone, it's like, hey, do you mind if I, ask you a conversation? Or do you mind if I ask you a question? Can we talk about something that's been on my mind for a while? Do you mind giving me advice about something that's been troubling me for a while? And I think setting the stage is like, prefacing it as it's something that I've been thinking about, and I would really appreciate your input so that they know that, so that they're ready to listen, they're ready to give advice or share whatever it is that you feel like they can share with you.
I'll add one piece to that. I have been doing more research on just understanding communication, and over 80% of communication is through body language and tone, exactly what Dr. Reni said. So I'd encourage, and we've talked about this in some episodes around texting versus emailing versus talking versus video, especially around topics as health, mental health, physical health, sexual health, that can get very, very fast. And so as teens, I would encourage all of you to lean into the voice notes more. It has been a good tool for me, whether it's on WhatsApp or iMessage, or if it's safe, if it's a safe space between you and that person, having like an in-person conversation or even a FaceTime, so that they can hear your voice and you can hear their voice, because so much can be misinterpreted in a text message. And especially when it comes to like health decisions, whether it going back to around sexual health, maybe if you're talking to a partner or someone around, I may be pregnant or may not be pregnant, or whatever it could be. So much can go through on in that, and it can get kind of scary kind of fast. So that's one just form of communication that I personally have been learning. And as teens, coming back to that, because we've been in a virtual world for so long, that social anxiety is real, and how to be able to ease our way back into it is important. So thank you for sharing that, Dr. Reni, and thank you for having this great conversation with us. We are just exploring all sorts of things. One of our former podcast hosts has left us, Antonio, and so we're all girl, young woman, young lady, whoever you identify, crew right now. And so the topics that we're talking about now have just evolved, and we thought this was a really timely one. So we appreciate you, and we thank everyone who has listened and who will listen. We are excited to get back into our next episode on October 28th. You can catch the replay on YouTube, on Spotify, on iTunes, wherever podcasts are downloaded. And please share this with a friend. Share it with a female friend, a woman friend, share it with a man friend, share it with a person friend, so that we all can be more aware about ourselves and each other, because when we know ourselves, we're able to take better care of each other. Now, I appreciate all of you all, and I hope that you and me have a great rest of our week. We will see you next time. Bye.